I'm coming in from a lab perspective, and I know that for enzyme replacement therapy, you will mainly need to have testing, enzymatic testing or genetic confirmation. So we want to offer a little bit of light. There is testing available on the continent. We've been working together with Chris Hendricks and together with International Gaucher Alliance for a number of years now to set up a network across Africa, and we've been systematically expanding the footprint in Africa to more and more countries. And I'm briefly going to present to you about that in the next few slides. So just a little bit of background on the lab where I come from. So we are university based. We are one of two laboratories in South Africa that perform tests for inborn errors of metabolism together with normal research functions that's associated with academic setting. And we also have funding from government for metabolomics expertise. So we are also known as the National Metabolomics Platform in South Africa. So this is just in a nutshell who we are. I've included the link to our website there so that you can see the different diagnostic tests that we offer, as well as research opportunities that we have available, and a little bit more about the platform. So you're welcome to scan the QR code if you want to find out more. And our contact details are also on the website. Also, just a very brief background because I'm aware of the time and I want to go more into the practical workflow in the next few slides. So the LSD impact network coverage is shown there on the left-hand side, the first map. So you will see that we've got already a large footprint across Africa. And then the second map in the middle shows the number of referrals that we have received as part of this initiative to date. And then the pie graph on top is the one that I'm most excited about. So what we typically see in South Africa from our lysosomal storage disorder testing referrals, before we do any interventions and awareness trainings on the disease and how when to suspect the diseases, we had about a 2 to 6% diagnostic hit rate for referrals that ends up in a confirmed diagnosis for the 6 lysosomal storage disorders that makes up the lysosomal storage, the 6-plex LSD test. What we have seen through the Africa Network and the Capacity Building in Africa initiative is with intense training and regular training and specific events to increase the awareness on what to look for, that this has actually helped a lot to get more accurate referrals for the test. And we are at this stage very close to the 50% mark of all referrals ending up in a confirmed positive diagnosis. So that is really good to see that the effort is paying off, and more events like this is critical to ensure that we keep this going forward and that we increase the awareness on the diseases. So next I'm going to go into the specific step-by-step workflow for what we call the 6-plex LSD test. So the 6-plex LSD test is basically a single test that we have that is set up for specific lysosomal storage disorders, namely Gaucher disease, Pompe, Fabry, MPS, ASMD or Niemann-Pick, and Krabbe disease. So whenever you have a strong clinical suspicion for any one of these 6 diseases, you request a 6-plex LSD test. It's one test that's performed, even though you indicate your strong clinical suspicion for one of the 6, all 6 are tested simultaneously. It is an enzymatic test on LC-MS/MS. We work in collaboration with Sanofi South Africa that has assisted us in setting up the test and is currently sponsoring testing in South Africa. And International Gaucher Alliance has assisted us in obtaining funding and direct relief as well to provide testing for the Africa network as well. So what we do, step 1, you will contact us at the lab. we will send you a kit. In the network that I've shown on the previous slide, there's already a number of kits available in the country, but if there is none, we will definitely make sure to send a kit to you as soon as possible. The kit contains all of the required documentation in terms of patient consent, clinical information, the DBS kit itself, as well as a step-by-step instruction that I'm going to go through now on the correct DBS collection, handling procedure, shipment, etc. Um, After you have collected the test and it's dried for the appropriate amount of time, the sample will get shipped to South Africa via the Serba Lancet labs where they are available. There's one or two countries in the network that there's no footprint yet for Serba Lancet, but we have successfully worked with neighboring countries as well to get samples sent to the neighboring country where Serba Lancet has a footprint, and then getting the samples to South Africa. Um, we are currently in process as well to streamline the logistics with Serba Lancet through formal service level agreements that per country level. So this is a really big step for us as well to formalize and make this more sustainable going forward. Um, the Serba Lancet lab will then use a specific mnemonic that they've set up in the labs to lock the sample. The sample gets shipped to the Richmond lab in South Africa, and the Richmond lab in South Africa sends the sample to us the same way that the normal LSD referrals in South Africa takes place as well. Then when the sample reaches the lab, we have a 10 day turnaround time for upon receipt of the samples for the enzymatic test. Um, and when a test is abnormal, we refer them as well to Archimed for confirmatory testing and genetic confirmation. We are also working on options to perform the genetic confirmation in South Africa, which will decrease the 12-week turnaround for the genetic confirmation that we currently have significantly. So that is in a nutshell the different steps. But if we have an abnormal enzymatic test, you will automatically receive a preliminary report from us so that you can already start looking at options and treatment options and advise the patients further while we still refer for the genetic testing to Archimed. This is just two pictures showing you on the left-hand side how the kit looks. So this is an A4 envelope with all of the documentation inside. And then on the right-hand side is the specific DBS card. It's a Watman 903 card. But because we refer at this stage to Archimed, there's a specific information that they want together with the samples. So just a few things that I want to make you attentive on is to please check the expiry date of the card to see if it's still valid. If the card is past expiry, please contact us to know if we will still be able to use that card or if we should maybe send you a new card. Please complete the patient information, and then for your own records, on the right-hand side of the card, there's a red number. That's a tracking number for future communications. Please keep that at hand. It just enables us to facilitate communication between us and Archimed if we want to inquire about results. And then very important, at the bottom of the card, you will see the different tests. So there are more tests there than the 6-plex that we offer enzymatic testing for. But please select only the most appropriate. As I mentioned, we will in any case test for all 6 conditions. It is important that you select only one option there. For instance, if you suspect Fabry disease, female, it automatically gets sent to Archimed as well for additional tests that we are unable to perform in our lab, as well as for MPS. We are able to test for specific subtypes of MPS on enzymatic level in our lab, but an expanded MPS is offered automatically by Archimed as well. So if you suspect MPS disorder, please select that so that we know to send the sample for that purposes. It just delays the turnaround time quite significantly, and it makes sure that you are able to get access to these additional tests that's offered part of the contract that we have with them. Now I want to go in a step-by-step DBS collection. It is really important. I know it sounds simple to do a blood spot, but what we have seen and feedback that we've had from onboarding training events, in-person training events from the clinicians, is that it actually helps to have a step-by-step approach. We've seen that by doing this, we were able to minimize the artifactual results that we receive due to poor sample collections or inappropriate sample collections as well, from a 40% down to a 10%. Very important, please make sure that all of the information on the cards are completed in full. The second step that you need to know, please wipe the area where you want to do either the finger prick or the heel prick to disinfect. Please do not use any iodine disinfectants, as this can cause interference with the test. So just a normal alcohol swab is sufficient. We recommend that patients younger than 6 months receive a heel prick, and older than 6 finger prick. If the timelines is not that strict, but basically if a child can already walk, then rather do a finger prick. If the child is not yet mobile or walking and crawling, then you can do a heel prick on the child. Please, no venous blood or EDTA or any type of anticoagulants or heparin or SST blood tubes. Rather do the prick with the lancet, because the chemicals in the tubes and the blood collection tubes interfere with the results. Very important as well that after you've pricked the site, the image there shows you to please do the prick to the side of the finger or to the side of the heel. And then important to wipe the first blood drop. So this helps to eliminate the coagulants and make sure that we get a nice proper on the cards, and it doesn't interfere with any of the testing. So very practical approach. People also want to know how big a drop do you need on the blood spot. So what our lab technician has always told us that do not milk the finger. Keep it pointed downwards, and then when it feels like the drop is about to fall to the floor, that's the point where you make the drop on the blood spot. It will be a large enough volume that it can saturate all the way through the card, and that is exactly what we want. What we do not want is any overlaying of samples or any addition. So please do not drop more than 1 drop on a specific place. It really interferes with the samples as well. So only 1 drop per circle. Please do not spot on both sides of the paper to make sure it goes through. Remember, the entire Whatman 903 is a filter paper. It's treated the same way. So if you were unable to spot correctly within the circle, if you are able to do another spot that's not in one of the designated circles, that is also perfectly fine, because the card is the same throughout. There's no special pre-treatment in this designated circle areas. Then very important as well, the DBS samples are a bit sensitive for extreme heat exposures and for extreme humidity. So please just dry the cards at normal room temperature for about 4 hours until the spot is completely dry before you close it off and putting it in an envelope. There's no special equipment needed for the purpose to leave the cards for 4 hours. A normal box that you can cut slits in the box and place the cards in there to allow them to dry for 4 hours before you close them in a Ziploc bag with a desiccant that's included in the kit. And then after the collection is done, please take it to your nearest Serba Lancet branch, or if there's no Serba Lancet, we will assist you in next steps to get the samples to us. Typical errors that we usually see that cause artifactual results. If there's any type of contamination with water, powder, or anything that was on the surface, so the card was left lying on a bench top or a desktop or anything where dust and things can interfere. So that can cause artifactual results. We sometimes see a serum ring on the samples, and that is typically when a site has been milked to get a nice enough blood, a big enough blood spot. What we have seen from practical experience at recruitment clinics as well is that MPS patients tend to have a slower blood flow. So warming the site of the prick will usually help to stimulate the blood flow without milking it. So if you can just ask the patient to warm their hands or underneath the armpit or something, just so that it's warm enough, and then you can do the finger prick. It really helps with that. We often get a supersaturation where more than one drop has been spotted over each other, and that causes artifactual results. We also see very often clearly that the syringe has been used to spot the samples, and you do not get that fully saturated spot that you're able to punch in the lab for the analysis. And often enough as well, missing information that cannot be relayed back to a specific patient, and we cannot process the samples further. So just in a nutshell again, so if you need any assistance with a patient, to refer them to us, you are welcome to use the email address and the phone number that's provided on the screen, or on the contact page of our website. From there, we will be able to assist you to give through these details, because I know it's not going to be feasible now for you to remember all of these names, all of these addresses as well. So we will send this information through to you in a separate email. It's just important that when you suspect a patient, please contact us, and we will put you in contact with the closest Cerebral Lancet branch, or the clinician that we have onboarded already that can assist you with kits. And the process from there will be collecting the sample, taking it to a Cerebral Lancet lab. They will log it on their system, send it to us, and from there on, we will be able to give you reports back. So that is me in a nutshell, and I'm happy to take any questions that you might have. And please feel free if you need any assistance with logistics regarding sample collections. Please feel free to contact us at any stage. Thank you very much.